Very good idea has allowed you good idea. Scientifically, yeah.
Maybe you can actually
Two such clinics. Oh, great. Hello, how are you? Mr. Raman. Hello.
I think my father
All the best.
You can give me the number, just 1 minute. Sorry, 1 minute. Rajiv Vasudevan is our partner from Bangalore. Ayurveda. Thank you, sir. Yes, sir. No, not a problem.
Even if they are not No, I have
The disease burden. Lifestyle diseases today contribute around 45% of the disease burden in India. More than half of all deaths occur due to chronic and lifestyle diseases, and that number is expected to rise to 2/3 by the year 2020. So when we talk about healthcare, this is, one could argue, the major chunk of healthcare need in the country today. And cardiovascular and neuropsychiatric disorders are already 10% of the total disease burden and a major contributor of non-communicable diseases. The important thing to observe, and the basis for the model that you're sitting in today, is that there is no long-term cure available in allopathy alone for many of these chronic disorders. So when Mr. Vasudevan and Dr. Krishnamurti met, they realized that there was a great need for a business model that could serve the chronic disease and lifestyle disease demand, and also could do it in a high-quality way at an affordable cost. That's really the background to what's going on here. Just to look at the spectrum of healthcare and the context again for this center and how we think about health. Within healthcare, we believe there's a wellness market, which is growing every day here in India. There's a preventive care market, still underdeveloped, a huge need for preventive care, but a lot of people only think about it when things go really wrong and in an emergency way. There's a curative market, both acute and non-acute. There's emergency care, for which allopathy is an excellent solution, and there are many large hospitals all over India today for that. And then there's a post-acute need. After someone's come out of surgery, they've come out of the big hospitals, where do they go? Where are the centers for really high quality, affordable recuperation and rehabilitation after a stroke, for example, or after cancer? What's envisaged here at Tejas Ayurveda is an integrative approach to healthcare. The purpose being to maximize patient outcomes. That's always the ultimate goal of anything that we do. And what we mean by integrative is that we're bringing together a range of medical disciplines. We have in India Ayurveda as a medical system, which is it's the perfect formula to match many of the chronic diseases we see today, because it looks at the person as a whole. And chronic diseases are complex and often require you to understand the person as a whole. So let's use the Indian healthcare system of Ayurveda and really take it to the potential that it has. We also have the best and highest quality of allopathy services available, spearheaded by Dr. Krishnamurti, neurologist and neuropsychiatrist. We bring together top allopathy physicians in this center. And then we have a range of other healthcare inputs: occupational therapy, physical therapy, nutritional inputs, other alternative treatments such as child therapy, and psychological counseling. And by bringing all of these solutions together and uniting them with what we believe is a common medical philosophy, inclusive healthcare, which really means looking at the entire patient, their history, their genetic makeup, their presenting complaints today, but also other health experiences they've had in the past, looking at their family, looking at them as an entire unit. It's a results-based approach, which means really tracking according to the medical outcomes. One of the pioneering things that Ayurveda hospitals has been able to do is bring a process-driven, a documentation-driven, and a results-based approach to Ayurveda medical care, so it can integrate seamlessly with results-based allopathic medicine practiced by Dr. Krishnamurti and the Tejas team. We believe in whole person health. I've already described how important that is to us. Individualized health, which means customizing medical management plans rather than a one-size-fits-all solution. And when we say team-based, we mean getting the family involved as well. Healthcare shouldn't just be about one person fighting on their own. It should be about a solution which includes the support of all of the family and loved ones around that person. And we welcome that here at Tejas Ayurveda. And finally, lifespan care. What we mean by lifespan care, drawing on the previous slide we showed, is that someone throughout their life might experience a need for curative care, both post-acute and pre-acute care, but also promotive care and wellness. When our patients have been through something and we've helped cure them, how do we become their lifelong partner? How do we help them stay healthy and optimize that health? So that's the medical philosophy which we believe unites all of the different healthcare solutions that we're bringing together in this center. To give you a good idea of how it works here and the patient process flow, we've developed what we believe will be a seamless way for a patient to draw on all of the most powerful ways to improve their health. When a patient comes to the door at Tejas Ayurveda, they'll first see a care manager. We have 2 here in this center who work very closely with all of our doctors and help the patient think through what they're experiencing and direct them to either an allopathy physician, if that's what they choose, or an Ayurveda physician, if that's what they choose. At that point, it really is the patient's choice. Which physician do they want to see? But beyond that choice, the physician will essentially work with the patient to then include all of the different kinds of healthcare inputs that can best improve their health. So there's really no division between services offered here from a patient perspective. You can avail of all of the services in one center, and from a patient perspective, you see your health management as being seamlessly integrated, whether it's psychological counseling inputs, physical therapy, occupational therapy, the complete range of Ayurveda treatments, which is, I think, in recent times, a lot of centers have been doing oil application therapies for Ayurveda. The complete range includes the core cleansing, the panchakarma techniques, which are also practiced here. So a patient can avail of the full range, nutritional inputs, and alternative health inputs as well. What that means for us is that we can cater to a wide variety of medical conditions. You'll notice on the boards around here we're using the term multi-speciality and family health clinic. The idea is that your entire family can avail of healthcare here at Tejas Ayurveda, because by bringing together so many specialists under one roof, we can provide treatments for a very wide variety of conditions, something which normally one might only find in a large hospital format, and we're bringing it here to the local level and to the community level. One of the most important things to talk about going forwards, which Rajiv and Dr. Krishnamurti will also describe, is how we believe by coming together as a partnership, we can use original cutting-edge research and process integration to come up with what we think will be pioneering disease and lifestyle management programs. They have the potential to genuinely alter the paradigm of how disease and lifestyle illnesses are managed. Again, extremely common, and I would say increasing every day. So the goal of these programs is really to allow the patients to experience something where they can feel guaranteed that the best of different medical systems are being offered to them through a tested process. And finally, just to end, we believe very deeply in being socially responsible. It was again a uniting theme when Ayurveda and Tejas came together, was that we didn't want this to be a niche market. We've been talking about how important it is to serve these diseases because they're so widespread. We don't want this model to be a niche model. It's really for every man. And so while we want to offer a premium healthcare experience for the discerning consumer, we also have a business model which allows subsidized or lower priced care programs of the same quality to be delivered to base of pyramid or low income consumers. And finally, because of the dearth of preventive care that's available globally, we see this as a new trend. One of the goals of the center is really about wellness. How do we promote behavior change based on Ayurveda and modern medicine inputs to get people to think about staying healthy, not just curing when things go wrong? So with that context, I'd like to hand over to Dr. Krishnamurti and Mr. Rajiv Vasudevan for any questions that you might have.
Just take a 2-minute break to light the lamp to burn and all.
Great.
I request you to stay here. You can watch it on the screen, and we'll be back for questions. There's already one person who spoiled the photo.
That's a lovely photograph. That's very good.
Ideally would have been if I am there so that I can contrast. Why not?
Let him go there.
We'll let you.
Yeah, that's good.
Clara has given you a concept of this center and what the center will do. And from our perspective, the way we see it is that it's a great opportunity to develop innovative programs. Most often what happens is most of healthcare is acute healthcare, and the focus is all about acute illness and hospitals. But most of us don't need hospitals. Most of us, only 10% of the time is a healthcare intervention, a hospital-based intervention. 90% of the time we are having interventions which are clinic-based interventions. And what has disappeared over the years in the Indian context is the idea of a family health clinic. We don't have family doctors anymore, we don't have family clinics anymore, and we are forced to go to hospitals which specialize in acute care. They are not really there to serve our needs. And what we have felt at Tejas Healthcare Solutions is that there is a need for good primary care, good quality primary health care that will take the entire person as a whole and deal with the person as a whole, not just the person, the whole family. To give you an example, if you get a headache, which is one of the things I specialize in, say, you get a headache and you go to a doctor who you don't know, he's likely to suspect the worst things in the world, and rightly so. He'll say, oh, you might have a brain tumor, or you might have this funny aneurysm in your head. If you go to your family doctor, he's going to say to you, you know what, you're a tense guy. You're very likely to have a headache because of tension. So are you tense today? Or have you been tense in the last 2 weeks? Now that intervention, that primary care intervention, makes so much of a difference to what happens to you after that. If you went to your family doctor, you may not end up having a lot of things done. He's going to sort you out without too many investigations, without too many complex treatments. Whereas if you go to someone you don't know, then you're likely to have many things done before the person concludes the same, that, oh, your headache is just due to stress. So in the first place, primary care interventions need to be in environments that are conducive, comfortable, near your house, and repetitive. They have to be where you are comfortable going to the doctor. The doctor knows you, you know the doctor. This is very important. The other thing is that it's not enough for most healthcare situations for you to get a prescription, because prescriptions are not adequate in many, many situations. You need more than a prescription very often. So in a typical situation, you end up going to 10 different places to get those pieces of advice. The physiotherapist is somewhere, the dietitian sits somewhere else, a counselor is somewhere else. All these people have a role in your healthcare, but they are not under one roof. And in the Tejas family multi-specialty family health clinic model, this is what we've been trying to resolve, that it's important that we have the best interventions in primary care. Then, if you then think about what does a good proportion of our population have, we have an aging population. People are getting older and older and older, and they're living longer. It's a population with a number of chronic diseases. We are now told we are the diabetes capital of the world. Ischemic heart disease is growing. Strokes, brain strokes are growing. And then dementia, memory loss is growing. So we have all these problems out there in the community. We need more than medicines to get people better from those problems. So we need more than medicines, both to prevent the problem from happening and more than medicines to get people better once they've had the problem. So obviously the first thing is prevention and promotion. Someone's got to tell you, don't smoke. Someone's got to tell you stop drinking as much as you're drinking. Someone's got to tell you that you have to be a little more careful about your diet, or you've got to lose some weight. Someone's got to tell you exercise. And that is the role of the family health clinic. But we do more than that. The idea is to put for you, in front of you, a range of interventions that you can then choose from. So if you have neck pain, rather than taking painkillers for 6 months, a short course of treatment may actually stop you from having that neck pain. It may restore the balance in your musculoskeletal system that you lost because you're working too hard on the computer, or you're driving your bike with your cell phone like this, or whatever, right? There are so many social reasons why today we get symptoms, physical symptoms. If you have stress, it's terrible to go and have to sit in a situation where people have serious emotional illness, because you feel that you don't share that. What you have is a minor problem, but you need an opportunity to talk about stress. In the last generation, you had an extended family to talk to. Today, there is no extended family to talk to. There's no one to share your stress with you, which is why you're stressed out in the first place. So you need interventions that will help you. You need a counselor. You need someone you can just have an easy chat with, without having to take pills, without having to go through all kinds of treatments, or without having to feel stigmatized in some way. So what this model does is it puts all these interventions in the family health clinic model, and it gives you 100% consumer choice. You can come in with the help of the doctor, with the help of the care manager. You can choose which of these do I want. So if the doctor tells you actually you're a little bit stressed out, it's not then an instruction to stop being stressed out. The instruction is then maybe you should see a counselor, and the counselor is right here under this very roof. Now, extending that, we also understand that modern medicine does not have the answers to all your problems. It has answers to several problems, but it doesn't have answers to all your problems. Curative treatments are very strong in modern medicine, and we can never deny that. Modern medicine is very, very strong in curative treatments. But when it comes to restoration of health, and today what we call quality of life, because what's the purpose of treating someone? It is to help them get their quality of life back. So if you talk about getting back your quality of life, then modern medicine doesn't really have all the answers. And our own systems, traditional Indian systems of medicine, have a lot of answers that over the years have got buried. They've got buried in misinformation. They've got buried because people didn't want to share those pieces of information. They felt the strength was in only knowing it yourself, not in making it available to a wider spectrum of doctors or the community. They are buried because we don't have huge textbooks that carry that knowledge. So there is a wealth of information out there which can be utilized for the good of the community to improve people's health. And that is what Ayurveda Hospitals has been doing, and I'm sure that Rajiv will share more about that with you as we go on. And here, therefore, what we have tried to do is bring in two systems of medicine, and we will in due course bring in other systems. We do have plans to have a homeopath. We do have plans to have other forms of alternative medicine, yoga, which have the ability to improve your quality of life and enhance your wellness. And that's part of what this clinic is all about. There are two things that this clinic will specialize in, apart from being a family health clinic and a center for integrative health. There are two things that we will specialize in. One is that we intend to, by working through patients, because we both have such strong process-based systems of working, we have very detailed evaluation systems, we have very detailed treatment systems, we have excellent systems of recording what we do. Both of us are united by that. And what this clinic will do is that we will use that as research material to understand from a number of patient interventions what works best for the person with diabetes, for the person with heart disease, for the person with stroke, for the person with dementia, for the person with epilepsy, for the person with high cholesterol, for the person who's obese. So what we call disease management programs and lifestyle management programs. So what we hope to do over the next year is develop a whole number of process-based programs, what we call DMPs and LMPs. And DMPs and LMPs today are the most contemporary thing world over, because insurers want them, governments want them. World over, health systems are looking for very well-defined processes. And we hope to do that through original work that we do under this very roof. So this is not just meant to be a treatment center of sorts. It is actually meant to be an enterprise that's got teaching, research, and good clinical care, high quality clinical care as part of it. And so these DMPs and LMPs, we will start introducing them one by one. Of course, because of my involvement, neurological disease and neuropsychiatric disease is going to be very important for us. But we do have excellent diabetologists, we do have excellent heart care professionals, we have a number of other professionals coming here, and what we do hope to do is integrate therapies for treatments for a number of diseases and offer people programs of treatment. And that's knowledge that is going to be useful in the wider perspective of a country as well, because this is very, very important, that people should have the access to the kind of care that they want. So there are 5 barriers to healthcare: availability, accessibility, and affordability. You can count them as one. Affordability is part of accessibility. Acceptability and accountability. Those 5 A's define healthcare. So we're making, in primary healthcare, we are making very contemporary treatment and blending both traditional and modern medicine available. Access is something we are offering by virtue of being in neighborhoods. Affordability is something we are conscious of. We know that everybody can't afford a high-end treatment, and we are developing, therefore, socially responsible models that we can use to treat people who are less well off. All of you know of my association with VHS, so there's always the need for us to develop models of that kind. We believe that these treatments will be far more acceptable to people than some of those very interventional treatments that are available out there. And that's something that we are very, very focused on. And we would like to be at the top end of accountability, that everything we do has high quality, is well monitored, well recorded, and the outcomes are well managed, so that we are able to offer to people very highly accountable care and not just say, oh, we did something, it didn't work out. We are there to try and make things different for people. So this is really the philosophy of Tejas Ayurveda with which we are setting off. And I'm going to let Mr. Rajiv say a few words here.
Good evening, ladies and gentlemen. I think you've already got a fair idea about what is being envisaged here, but just a few supplementary comments. You see, we talked about family health clinic in one breath, and we talked about chronic diseases in another breath. How does the two relate? And then you would also note that we have talked about the mothers of Chennai coming and inaugurating the center. What is the primacy of mothers in such a situation? You see, in a system like Ayurveda, which is quite different from what the general layman today makes of it. It's a complete medical science, refined over generations. The role of a simple thing like diet and lifestyle being the root cause of illness which emerges as a serious illness many years down the line. If the mother in the house were to be aware of those factors which are contributing to increasing the risk factors for that family, as Dr. Krishnamurthy spoke about, a good doctor is aware of the family unit of which the patient is a part of. So being able to really address it, and if the mother is able to say, my son or daughter is likely to have this particular risk factor increasing, probably it's the best way to look at healthcare, because you're preventing a larger catastrophe happening years down the line. But today, one doesn't have the choice to go and say that I'm going to do preventive care for everybody. You are also talking about people who are already suffering from a chronic illness. A chronic illness is defined by WHO as anything which is subsisting for more than 3 months. Just 3 months. And if you look at it, you'll realize that almost everything that you hear of has been there for a long period. Now, it means that the disease is not getting off that patient's back, because typically one may be treating the symptom and not the root cause. So that's where, when you bring modern medicine, which is highly systematic, rigorous, and you combine it with something like Ayurveda, the two are not in opposition. The two can work together, to the best benefit of the patient, because Ayurveda then brings in a different lens through which to see the same person's health. And then you combine the two together. So what Ayurveda really would do is to play a complementary role, and that's what we are trying to demonstrate through this venture that we have here, through the research that we expect will demonstrate that the systems can work together to create a new model that is of value to the communities. Like Dr. Krishnamurthy spoke about VHS, Ayurveda hospitals also, through its 6 hospitals across India, 2 in Kerala, 2 in Bangalore, 1 in Hubli and 1 in Bombay. 2 out of those 6 hospitals are actually located in the middle of low-income areas. One of them is in the heart of Dharavi, which is Asia's biggest slum, as you know. So we want to really demonstrate that Ayurveda as a system of medical care is not for just the rich or for just a leisure treatment, a relaxation treatment, but serious medical care for all segments of society. So we believe a judicious combination, integration of the best of both systems and the other systems, as Dr. Krishnamurthy spoke about, brings the best for the community. So with that, I think we should, Dr. Krishnamurthy and myself will be open for any questions that you might have. Dr. Krishnamurthy?
How many patients can the center attend at a time?
It's we are open right through the day. So, quite honestly, the number of patient interventions is, because they are all scheduled interventions by and large, we don't think there'll be any restriction on the number of patient interventions that we can do. If you ask me just for a figure out of the top of my head, in say, just for consultations, say we have about, between the 2 groups of doctors, we will have about 15 hours, no, more than that actually, about 20 hours of consultations we'll have in a day. So in 20 hours of consultations, we could easily do about 60 to 80 patients in a day without difficulty. But when you talk about interventions, treatments, they're obviously longer. And therefore, we have 3 Ayurvedic treatment rooms. We have a physical therapy suite that can take 2 people at a time, constantly. And we have 7 consultation rooms. So the total number of interventions at any one point in time actually is very large. And that we expect it to, because it's an outpatient facility rather than an inpatient facility where people are just staying here, people will be coming and going. And that's the other advantage, that we feel by locating something like this in the city, we will be able to enhance the possibility that people can choose these treatments even while they continue to work, while they continue to go about their normal lives. Because it's very hard to say, I'm going to take 1 month of treatment and go lie in a spa. I mean, most of us don't have such luxuries in life. So in that sense, this is very accessible to people.
From an Ayurveda perspective, 3 treatment rooms would translate to about a maximum of about 30 patients in a day, from 24 to 30 patients in a day of treatments. And
right. இதில் நல்ல கேள்வி ரெண்டுமே இருக்கு. சில பேர் வந்து அவங்களே சூஸ் பண்ண போகிறாங்க, எங்களுக்கு இதுதான் வேணும் அப்படின்னு சொல்லிட்டு. ஆனால் நாங்கள் சேர்ந்து வேலை செய்கிறதுனால நாங்கள் அது அவங்களுக்கு ரைட் சாய்ஸ் இல்லைன்னு ஃபீல் பண்ணினோம். இப்போ அலோபதிக்கு வராங்க, உங்களுக்கு அலோபதி தேவையில்லை, ஆயுர்வேதம் போடும் நீங்கள். இல்லை ஆயுர்வேதாக்கு வராங்க, இல்லை உங்களுக்கு அது தேவையில்லை, அலோபதி தான் வேணும்னு ஃபீல் பண்ணோன்னா கண்டிப்பாக பேஷண்ட் வில் பி கைடட் கரெக்ட்லி வாட் டு டூ அப்படின்னு சொல்லிட்டு. ஸோ பார்ட்லி அஃப்கோர்ஸ் இது பண்ணும்போது இட்ஸ் பேஷண்ட் சாய்ஸ். வி வாண்ட் டு புட் த சாய்ஸ் இன் த ஹேண்ட் ஆஃப் த பேஷண்ட். But partly the patient needs guidance because medicine is not something the patient knows about. And that guidance will be given by the doctors here. We have general physicians, both allopathy and Ayurveda, available through the day, morning and evening. So they will help the patient choose what is better for them. Very often our suspicion is both will become necessary. When it comes to treatment, both will become necessary anyway.
How many doctors are there?
In terms of general doctors, we have 3 doctors serving the clinic right through the day. But in terms of specialists, we have a number of specialists representing disciplines who will come in for segments of the day or who will be on call. So what we will do, for example, if we want a specialty that the person doesn't sit here, we have people who are already with us, whom we can fix an appointment with for the client. So the client doesn't have to go in any case in search of people.
இந்த 3 டாக்டர் நீங்க இருப்பாங்க சொன்னீங்க. அந்த 3 பேரும் அலோபதி டாக்டர்ஸா அல்லது ஆயுர்வேதா?
2 அலோபதி, 1 ஆயுர்வேதா. இப்போதைக்கு
Full time.
At the moment.
In allopathy, there is no remedy for chronic diseases like diabetes, AIDS, cancer. How about in Ayurveda?
There is remedy. Please be very clear. In terms of treatment, certainly for all the 3 conditions you mentioned, diabetes, cancer and HIV, there is very definitive treatment. But that treatment by itself, adu vandu quality of life it does not enhance. To some extent, the treatment helps the individual control the symptoms, helps the individual prevent future problems, extends the individual's lifespan. All that medical treatment does very well. So medical treatment is extremely important. But it does not always treat the complications, or it does not always prevent the complications. The complications are what are responsible very often for a poor quality of life. So just to go back to the illness, diabetes irukku, you also have peripheral neuropathy. You have a lot of pain. That pain doesn't come down with just diabetes treatment, or it doesn't come down just with medicines. Very often more than medicine is required to get that pain better, for which both Ayurveda and
allopathy
alternative treatments in modern medicine have answers. Physiotherapy can also help, Ayurveda can also help, together also they can help. And the same thing is true for a number of chronic diseases. So for example, someone with say a heart condition, now they need to strengthen their muscles of respiration. They need to improve their fitness in order to prolong their life and to enjoy a better quality of life. Now both of us can do something there. They need medicines in order for the heart to work better, to have a good rhythm, to control the blood pressure, all that. But they also need these other treatments in order to enhance their quality of life. And what typically happens in the hospital environment or in a clinic environment is the other treatments are not available. Or if they're available piecemeal. They are not available as a whole. And one other example I'll give you, many people come to me at the end of the consultation, what can I eat? Enna saapadalam, enna saapadakoodadhu. Now what we do is we do a nutritional assessment and give them a chart. What will be good for you to eat? So rather than me giving them 2 lines of wisdom at the end of a consultation, they actually get that this is your weight, this is how much more overweight you are, this is what you should be doing in terms of a diet. Or you have a family history of diabetes. If you don't want to get diabetes in your lifetime, or you want to prolong the onset of diabetes, this is what you should be doing. So that's the other side of it, which is very, very important.
So just to add to what Dr. Krishnamurthy was speaking about, so if you take something like diabetes and we talked about cancer, so the beauty of an integrated approach is that I'm not talking just in terms of what this center offers. Perhaps a cancer patient goes for treatment, radiation treatment or chemotherapy to a hospital. But once he's out of that treatment, the quality of life gets compromised so significantly. There are very good methodologies, both in Ayurveda and through the other complementary therapies that can be brought in to ensure that this patient's quality of life improves. But take something like diabetes. As Dr. Krishnamurthy said, the complications from diabetes is the real, apart from getting the sugar level down, the things which have already gone beyond control, whether it's neuropathy or retinopathy or nephropathies, etc., which comes from acute manifestation of diabetes. Ayurveda has got time-tested approaches. For example, in Ayurveda, there are 20 types of diabetes defined in the scriptures, and which it tells which are the ones which are treatable and can be brought down, which are the ones which cannot be. And there are insulin-dependent diabetes which are best managed in modern medicine. So this approach which brings the best to the patient in future is possibly the right way to look at things.
எதிர்காலத்துல இதர மருத்துவ முறையோடு ஹோமியோபதி, சித்தா போன்ற மற்ற முறைகளோடையும் இன்டகிரேட்.
Absolutely. Integrative medicine நீங்க பார்த்தீங்கன்னா அதுதான் அந்த கான்செப்ட்லயே வந்து patient is very important, patient centered, quality of life and wellness, without being ill, be well. Wellness is very important. Use a choice of approaches, not just one type of approach or இதுதான் செய்யணும்னு இல்லாம a choice of approaches is very important. The choice is put in the hands of the patient, and all different types of treatment have got value. It is choosing the right treatment that is important. It is not that the treatment is wrong. Certain treatments are more effective in certain situations than others. So choosing the right treatment, and once again, we can't, unfortunately, because patients don't have the knowledge themselves to make the choice, the patient has to be guided to make the choice. So we have the options, but because we are all working together, what we hope also is that we will be fair to the patient and fair to ourselves and talk to the patient about what may be better for them. And that will enhance, therefore, the options for the patient.
Are you going to put them together in packages, sir?
That's for the disease and the lifestyle management programs. So if you come to us with a specific disease like stroke or dementia or diabetes mellitus, we will have very specific integrative programs. If you come to us with a specific lifestyle problem, like for example obesity, lack of sleep, stress, once again we'll have an integrative program where we address both. Whereas in certain other situations, it would be individual treatments that people choose.
Could you give me an example? Can you say a package?
Okay.
What
Let me give you okay, let's take a patient with stroke. Okay, someone with a hemiparesis. In fact, no, let me give you a very real life example. Okay. We had a patient recently in one of our other centers where also we have some Ayurvedic treatments. We had a patient who came to us with a history of both an emotional illness, with symptoms which are of stress, psychosis, those kind of symptoms, and an inability to walk. And she had been managed by different people in different ways, but neither was controlled. Her walking was getting worse and worse and worse. She was wheelchair bound when she came to us. Her emotional illness was no better as well. Now what we were able to offer her through a combination of Ayurvedic treatments, medicines from allopathic side, and intensive counseling, we were able to not only improve her gait and mobility, she started walking around her house on her own. She was no longer wheelchair bound, which is very important to her because she's in her late 20s. She also became emotionally much better because she had the option of discussing with the counselor her problems. The stress was not so high. We were able to help the family manage her better. Now this, getting somebody who's wheelchair bound, hallucinating, confused, to a mobile, reasonably able to interact, starting to help within the family, is a very big step forward. Now, I don't think we could have done it alone without the access to a wider range of treatment. She needed physical therapy, she needed Ayurveda, she needed counseling, she needed medicines. She needed all those treatments. And many chronic and complex and disabling conditions are like that. Very often you have diabetic neuropathy, you have difficulty in walking, you're also very depressed. You feel that you're losing your memory, you're losing your abilities, you have a lot of stiffness, you have a lot of pain. So when you get a combination of conditions like that, there is a need for an integrative approach which brings together all the systems that can help you.
And just one more nuance to that part being that typically today you take a person who is above 40 in India, he will be having a group of diseases. He'll have diabetes, he'll have backache, I have some gas problem, or constipation. So these 4 or 5 things come together. Now, today with the specialization which has crept into modern medicine, I have to meet 4 or 5 doctors. Each time I have to go and meet one person for my elbow, for my knee, and then each is such a super specialization. So in the process, you miss the larger picture. That's where exactly a center like this, whether it is all the specialties of modern medicine being represented, or bringing in a truly Ayurveda approach to what is the appropriate diet and lifestyle, which goes one level, beyond the nutritional thing alone to the prakriti, the constitution, the metabolic capability of the person. So these come together. The patient now has an advantage to say, my diabetes, which is insulin dependent, I manage through modern medicine. My backache, I manage through maybe Ayurveda. My skin condition through this. So he can get, but without compromising one or the other, ensuring that the doctors will decide what is best through this protocols.
The other thing that, just to point out to you, we have 2 very important groups in our country. The one group that we have are children. A very big population of our, very proportion of our population are children and young adults. Okay. The other big group that we have are elderly. and it's a growing group. The number of people over the age of 60 is a very fast growing number. With children, we have awareness today of a number of problems. They have problems with learning, they have problems with memory, they have problems with hyperactivity, they have problems with education, they have problems as they get older with regard to behavior, with addictions, with regard to activities that are not considered to be acceptable to the family. So many things, career choices. Modern life puts in front of you n number of pressures. In the old days, if you had a hyperactive child in the house, there were 10 people who would manage that child. Nobody ever felt tired. Now a hyperactive child is in 750 square feet of space, 2 bedrooms and a mother. That's the typical middle class hyperactive child. He doesn't have anywhere to go, so his hyperactivity gets even worse. The mother is under tremendous stress because she can't control that. So there is definitely a need for interventions for these children. And for children with learning problems, behavior problems, memory problems, and social interaction. Today the opportunities for a child to socially interact are so poor that it's only when the child goes to play school that you suddenly see the child socializing. He does not socialize when he's at home because there's nobody to socialize with. The only other person to socialize is the mother most of the day, if she's not working. Otherwise it's the maid. So there is definitely a need for interventions for that whole population, and we have a very good child specialized facility here that will take care of children through various forms of therapy. So we have behavior therapy, we have special education, we have neurodevelopmental therapy, and we have innovative forms of therapy like art therapy, dance therapy, play therapy. Because children will not, you can't sit down and talk to a child. He gets bored after 5 minutes. So you need innovations. So that's one group which needs to be helped. And again, they do very well. Children also today have very early onset of diseases. Obesity is very prevalent in adolescents today. Lifestyle diseases are becoming more prevalent. Early onset of diabetes is a problem in India. So we do hope that we'll be able to offer all these children a lot of lifestyle and disease management programs. Elderly, the longer you live, the more the problems you get, because it's wear and tear. As your systems age, they start giving you trouble. So people have problems with walking. People have problems with maintaining their urinary continence. People have problems with memory. People have problems with digestion. I mean, the number of elderly people with their either constipation or indigestion is huge. People have problems with difficulties like breathlessness. If almost every part of the human body starts malfunctioning at some level. And once again, for them, we have much to offer, much more than just pills. And that's the whole idea of a center like this, that we can actually restore wellness in an older person. And we've had several examples of that. We've had people, for example, with Parkinson's disease, who are virtually immobile when they come to us. And after 2 or 3 weeks of intensive work and treatment by our team, their mobility is far, far better. They're actually walking around on their own. Now, for someone who's virtually immobile, to be able to walk around, it's a huge leap. You feel so good, because why should you, even if you're old, be chair-bound? There's so much that can be done for you. The same way, because of poor management, very often people with memory loss, what's called dementia, very often people with memory loss end up being stuck in very bad environments, because of which the behavior also deteriorates. Families don't know how to manage people when they have such problems. So one of the things that we do here, and we've done this for a long time, we're operationalizing it better, we're bringing in more integrated processes now, is that we work with the family to improve the outcome of the individual. And I'll tell you why. In a country like India, you don't have health insurance, penetration is less than 10%. The formal care systems are very, very poor. If you have an older relative who is not well, who's got either memory problems or physical problems, there are very few places in the city where you can put them and feel happy. Most of the places that are available are not ready for that. So the family is the center of care. The family is the unit of care. And teaching the family to care, whether it's the child, whether it's the elder, teaching, or whether it's a young adult who is in some way affected, teaching the family to care is ultimately the best way forward, because the family is interested in the individual, they want to see that person better, they care for him, they love they love the individual, they are very, very likely to do a good job if you transfer some skills to them. And that's part of the treatment that we do, is work with the family. And that again is a very important part of this kind of medicine in India, that you're able to work with families. It's extremely important. There's one other thing, which is many things in India get swept under the carpet. For example, if we are undergoing some emotional stress, either in our work or in the family life, we don't want to talk about it. We start getting physical symptoms instead. That's called somatization. Somatization is converting a psychological conflict into a physical symptom. Now, so I'm so stressed out because my boss is bad to me. Rather than thinking about that, I say, oh, I've got a headache, I can't go to work today. Or I've got a stomach ache, I can't go to work today. So I produce, not willingly, voluntarily, without my knowledge, I produce a physical symptom. Now, you'll be interested to know, 30 to 40% of medical consultations are these kind of symptoms today. 30 to 40% of medical consultations across the world are spent by people who have an emotional or a stress-related problem, which is coming out as a physical problem. Now, what stops people with stress going and seeing seeking the right treatment? If you ask yourself that question, it is to do with the fact that most people don't feel that unless they are seriously ill, they should go to a doctor who specializes in mental health. Right? If you told me you need to go see a psychiatrist, I wouldn't be very happy. Most people are not. Right? On the other hand, most people, given the opportunity to talk and discuss their problems with a professional, are willing to share and do feel a lot better when they've done that. And one of the things, therefore, that we are doing in Tejas Ayurveda is that we are mainstreaming this. Stress-related illness is now, treatments are available in your neighborhood integrative health center. You don't have to go to any specialist, you don't have to feel that you're seeing somebody you don't want to see. You're not making something complex that need not be complex. There is a place for serious mental health. There is a place for minor common mental disorders. And if you have stress-related common mental disorders, because of work, because of family, because just life is so stressful, then once again we are able to offer both modern medicine approaches and traditional medicine approaches here. And we feel that's a very, very important step forward as a model of care. We don't conceptualize Tejas Ayurveda as a single center which is going to try and do something. We are looking at it as a sustainable, replicable model of care which can develop into something that works for a lot of people living in the community.
Mr. Vasudevan, தமிழில் கேட்கலாம். ஆயுர்வேத மருத்துவ முறைகளில் இப்போ அலோபதியை பொறுத்த வரைக்கும் நடைபெறக்கூடிய ஆராய்ச்சியை பற்றி செய்திகள் நிறைய வருது, மெடிக்கல் ஜேர்னல்ஸில் வருது, பாப்புலர் மேகசின்ஸ்லேயும் வருது. பட் ஆயுர்வேதாவில் அப்படிப்பட்ட நோய்கள் பற்றி ஆராய்ச்சி நடக்குதா, அதுக்கான தீர்வுகள் கண்டுபிடிக்கப்படுதா, அதெல்லாம் எங்களுக்கு தெரிய வருது.
இங்கிலீஷில் பேசணும். See, basically you're right that the kind of research which is happening in modern medicine, that level of research perhaps has not happened in the last few decades. But on the other hand, if you really look at today what is there in Ayurveda, there is, number one, over the last 20 years or so, there are 210 Ayurveda colleges in the country today. There are postgraduate programs with 16 postgraduate specialties. A medical graduate in Ayurveda spends 5.5 years, including 1 year internship. MD program is 3 years duration. So it's a thorough program happening. So every year you have these many MD graduates coming out of into the system with theses, research happening. Having said that, there is a lot more to be done. As Dr. Krishnamurthy mentioned earlier, the need to bring in more rigorous systems, documentation into Ayurveda is something which has been felt for a long time. Ayurveda Hospitals has been trying to do this for the last 5 years. At all our hospitals, we follow that. We believe through the Tejas Ayurveda Center, we can begin a process of demonstrating evidence for not just Ayurveda, but this integrated, unified approach for patient management.
அடிப்படையான கட்டணம் என்னவா சார்? அந்த பேஷண்ட் வராருன்னா கட்டணம்
Charges will vary, sir, depending on the treatments that people choose. In a center like this, for a primary care consultation, here it is 200 rupees for a primary care consultation. But like I said to you, we have two things. One is we have socially responsible models. We know that people who approach us all may not be possible, or may not find this possible. We will have options for them. We will guide them correctly. And we will not absolve ourselves of responsibility. I want to assure you of that thing. The second thing is that depending on the complexity of the treatment, the charges will obviously vary. Because most treatments have to be customized. You cannot just package them and say this is it. So depending on the complexity of the treatment, the time that is being spent with the client. But yes, I must tell you that this is meant for a premium health experience, this particular center. But this model and these processes are and will be applied in many ways. In fact, that brings me to a very important point which I've been wanting to make. What is important about what Ayurveda has done? With this now they have 7 centers. We have now 3 centers. What is important about what we are doing is we are developing models that are sustainable and scalable. The best models are always replicable. They can happen elsewhere.